Hello and welcome to the University Maternity Hospital Limerick. My name is Eileen Ronan and I'm the Director of Midwifery here at the University Maternity Hospital. I would like to start by congratulating you on your pregnancy and thank you for choosing the University Maternity Hospital to birth your baby. We have a wonderful multidisciplinary team of staff working here to support you and your partner through your pregnancy, during your labour and birth, and also after the baby is born. In the following videos, you will get to meet some of the members of the midwifery team who will show you a number of the supports and services we provide here. I hope you find them useful. I would like to end by offering you the very best wishes for a happy and healthy pregnancy. Thank you.
Hello, my name is Naro. I'm an obstetrician and gynecologist and Associate Clinical Director at University Maternity Hospital Limerick. We always ensure that infection prevention and control protocols are implemented across our hospital. This is absolutely necessary for us to keep our mothers and babies safe and also our staff. Please visit hse.ie to see what you can do to protect yourself and your loved ones. Thank you.
Hello, my name is Ditna. I'm a midwife at University Maternity Hospital Limerick. I'm going to show you around our hospital. There is a multidisciplinary team of highly skilled professionals, including students at University Maternity Hospital Limerick, who will care for you throughout your stay. When the time comes for you to be admitted to hospital, you take the front door entrance to reception. Always clean your hands on the way in. You will go to the receptionist and she will direct you to the maternity emergency unit. In the maternity emergency unit, you will be met by a midwife who will ask you what has brought you to the hospital today. She will take your temperature, pulse, blood pressure, take your history, listen to your baby's heartbeat, and may perform a tracing of the baby's heartbeat if necessary. This could take up to 1 hour, and you will be informed what will happen next. The Danu suite is one of the birthing rooms where you can give birth to your baby. You will be cared for by a midwife, and a doctor can be called if needed. Here we provide a relaxing environment with a birthing pool, walk-in shower and birthing balls to help you remain upright, change position and support you in labour. The midwife will discuss your birth preferences with you and types of pain relief available: gas and air, pethidine injection or epidural. You can remain active during labour, adapt an upright position and use the birthing balls in any of our birthing rooms. Once you've had your baby, you will be given an opportunity to carry out skin-to-skin contact and feed your baby. The theatre is beside the birthing room and is where a cesarean birth is carried out. After you've had your baby, you will be transferred to the postnatal ward. The baby is beside you all the time, which helps you respond to your baby's needs and feeding cues. You will stay on this ward until discharge. You may have the opportunity, depending on where you live, to avail of community midwifery services if available, which includes early transfer home if both baby and you are well. If your baby needs extra observation and additional care, your baby may be taken to the neonatal unit. Here, baby will be cared for by specialists. Thank you for watching our journey through University Maternity Hospital Limerick. It is our pleasure to support you through this process of becoming a new parent.
My name is Dr. Naro Imcha. In University Maternity Hospital Limerick, the care of all expected moms is structured to support them and their family throughout their pregnancy journey, ensuring both the mother's and the baby's health and well-being. The care is centered around our women's needs, preferences and choices, offering a personalized care experience throughout the pregnancy, childbirth and their postnatal period. There are two pathways of care that we provide. The first is the public antenatal care combined with GP. This combined care is provided free of charge to expectant mothers who are residents in Ireland. The care is delivered by a team of healthcare professionals, including obstetricians and midwives at the local hospital and the GP at their practice. Option 2 is private antenatal care, where the expected mother is seen by a consultant obstetrician of her choice throughout her pregnancy. This option provides a high level of personalized care. At the beginning of the pregnancy, the expected mother typically visits GP to confirm her pregnancy. Then the GP sends a referral letter to the hospital or private clinic based on the woman's choice. When the hospital receives the referral letter, it is screened by a multidisciplinary team and the patient is then referred to the appropriate clinic and pathway. The first pathway that we have is the supported care for women who are unlikely to develop complications who are low-risk pregnancies. This model is predominantly led by midwife either in the community or in the hospital. The second level is the assisted care, which is for women who have or develop a moderate risk of complications, and care is provided by a multidisciplinary team including midwives and obstetricians. The third level of care that we have is a specialized care for women with high-risk pregnancies who require specialized obstetric and medical care. Our aim is to ensure that all moms have access to high quality and safe care, and we look forward to meeting you here in University Maternity Hospital, Limerick.
Hi, my name is Carmen and I am a midwife and lactation consultant at University Maternity Hospital Limerick. I am part of the infant feeding team and also provide parent education with my colleagues Margaret and Catherine. During an antenatal class, we aim to work in partnership with you and your birth partner. We aim to provide evidence-based, up-to-date information imparted in an empowering, interactive way so that you can make informed decisions with your healthcare provider around your care. We want you to feel confident in your body, achieve a positive birthing experience, and to feel prepared for the transition to early parenthood. We provide a series of antenatal classes on a weekly basis. Currently, these classes are online. They include care of the newborn, preparation for birth in collaboration with the physiotherapist, when nature needs a hand, and postnatal care. These classes are usually attended between 28 and 36 weeks. We also provide a Wellbeing in Pregnancy class. This class is usually attended between 15 and 25 weeks of pregnancy and includes speakers from the physiotherapy department, the perinatal mental health team, health promotion and improvement, medical social work services, a dietitian and a midwife. Please express your interest in registering for antenatal classes before 20 weeks. You can register by emailing parent.educationumhl@hse.ie with your name, patient ID, expected due date and your phone number. Once you have registered for antenatal classes, you will also receive an invite and a link to an online breastfeeding class. This class is facilitated by my lactation consultant colleagues, Helen, Sheena and myself. Before your baby is born, you are entitled to take paid time off work to attend antenatal classes. Partners can also take paid time off to attend the last 2 antenatal classes. You are only entitled to do this for 1 pregnancy. More information on pregnancy, birth, breastfeeding and early parenting is available on the website mychild.ie and in the HSE book My Pregnancy, which is available online and from your healthcare provider. We look forward to meeting you at the antenatal classes. Thank you.
Congratulations on your pregnancy. My name is Sarah and I'm the Clinical Midwife Manager of the Community Midwifery Service here at University Maternity Hospital in Limerick. Our community midwives are a team of friendly, experienced professionals who are passionate about providing high quality, safe, holistic antenatal care which is tailored to each individual woman's needs. The community midwives provide antenatal care for women who are generally healthy and well with a normal risk pregnancy. A risk assessment is carried out at your booking visit. If your pregnancy is deemed normal or low risk, you will have the option of attending a community midwifery clinic for your antenatal care instead of coming here to the maternity hospital. Should you opt to attend one of our community clinics, you will just come to the hospital for your pregnancy scans. Most routine blood tests can be done by your community midwife at her clinic. At your community antenatal appointment, your midwife will check the general health and well-being of both you and your baby. Your blood pressure and urine are monitored, as well as the growth of your baby, their heart rate, position and movement pattern. There are many benefits to receiving your care from our community midwives. We endeavour to provide continuity of care where you meet the same midwife at each appointment. This allows for a more personal experience and provides an opportunity for you to build a relationship with your midwife. You will have more allocated time to ask questions and to discuss any concerns you may have about your pregnancy. Pregnancy and birth are a normal physiological event in a woman's life. Your community midwife will provide you with up-to-date, evidence-based information and will support you and your family to stay healthy in pregnancy and prepare for labour, birth and early parenthood. She will explain all options available to you and discuss your preferences for labour and birth. Midwives encourage active labour and birth using the Labour Hopscotch tool. They will show you exercises and positioning techniques you can use to help you achieve an efficient, minimal intervention labour and birth. We promote using the Danu Suite, the relaxing home away from home room in the labour ward here at UMHL. Your community midwife works closely with the hospital team and will make a timely referral for you to see an obstetrician should a complication arise in your pregnancy. You also have full access to allied health services based in the hospital, such as physiotherapy, dietitians, medical social workers and the perinatal mental health team. Your midwife can arrange referrals as required. As with hospital-based care, your community midwife shares your antenatal care with your GP. These visits are scheduled with you up until the birth of your baby. Our Limerick City Community Midwife Clinics are based in Barrackview Primary Care Centre on Lord Edward Street, Southside Child and Family Centre in Roxborough, St Munchin's Community Centre in Killeely and at Antenatal Health Centre. We also hold a clinic in Ennis Outpatients Department. All our clinic rooms are quiet and private with minimal waiting time and convenient free parking. If you would like to attend one of our community clinics for your antenatal care, just ask the midwife or doctor you see today if this is a suitable option for you. You can transfer your care from the hospital to the community midwives at any time if appropriate. If you attend the community clinic, you can change back to hospital-based care at any time you choose also. We look forward to caring for you and empowering you for a safe, confident pregnancy, labour and birth.
Hello. Pregnancy and childbirth is for the majority a time of hope and joy. Unfortunately for some, pregnancy and birth can be a time of loss and bereavement. My name is Rita O'Brien, and along with my colleague Marie Hunt, we are here to support and guide at what can be a devastating and traumatic time. We offer confidential bereavement support as well as practical advice for you and your partner. We maintain a link with your midwives and doctors following your discharge from hospital, and we organise follow-up appointments for you. You can contact us directly on 061 48 3196 or ask your midwife for more information. Thank you.
Hello, my name is Yvonne Tier and I am the Advanced Midwife Practitioner in Supported Care here in UMHL. I would like to tell you about the Birth After Caesarean Clinic here in UMHL. This is a midwife-led clinic which takes place every Friday in the antenatal department. Women suitable for the clinic will be identified at their booking appointment with their doctor or midwife. The purpose of the clinic is to firstly provide continuity of carer, and this means that you will meet the same midwife at each of your antenatal visits, allowing you to develop a trusting relationship with your lead care provider. Research has shown that this type of care is good for women, their babies and families, and even increases patient satisfaction by providing care in a more individualised or personalised way. Secondly, the aim of the clinic is to provide you with an opportunity to discuss your birth options when you have had a previous caesarean section, and to help you to plan for the birth of your next baby. Your midwife will provide you with education, information and support to help with the planning and preparation for meeting your baby. Your midwife will monitor both you and your baby's well-being throughout your pregnancy. Additionally, your midwife will give you an opportunity to meet for a debrief or a reflection on your previous birth experience, which can be helpful when considering your options for birth, whether that be a vaginal birth after caesarean, more commonly called a VBAC, or a repeat caesarean section. If you would like further information about the Birth After Caesarean Clinic, please ask your midwife or your doctor, who will be happy to answer any of your questions. And finally, best of luck on your pregnancy journey here with us in UMHL.
The Specialist Perinatal Mental Health Service supports women who have mental health concerns during pregnancy and up to 1 year after the birth of your baby. Being pregnant, having a baby, and the months following the birth can be stressful and overwhelming for many women, their partners, and support persons. About 1 in 6 women experience low mood or anxiety during pregnancy or after having their baby. Your mental health is as important as your physical health, and there are supports available should you need them. All women are asked questions about their physical and mental health when they book in for antenatal care. If there are any concerns, you may be referred to the specialist perinatal mental health team. However, many women are cared for by their GP or community mental health teams during pregnancy. Not every woman will need referral to the specialist service. The team has a consultant psychiatrist, a clinical psychologist, mental health nurses, midwives, a social worker, an occupational therapist, and an administrator. It is important that you tell someone how you feel. You are not alone in feeling this way. Accepting help early can result in a quicker recovery. You can discuss any concerns with the doctor or midwife when you attend any of your clinic appointments. If at any time you're worried about your mental health, don't hesitate to reach out for support.
Hi, my name is Niamh and I'm a Health Promotion and Improvement Officer at UL Hospitals, and I'm also a trained stop smoking advisor. Quitting smoking during pregnancy is one of the best things that you can do to protect your baby's health during pregnancy and after they are born. The earlier that you can quit, the better, but quitting at any stage of your pregnancy will be beneficial. Quitting smoking is not easy, but help is available. We know that people who get help from a stop smoking advisor are 4 times more likely to quit successfully. Here at the maternity hospital, we have a dedicated stop smoking clinic every Monday morning in the antenatal department. This service offers free, non-judgmental support either in person or over the phone. We can also refer you to your local stop smoking clinic if you wish to access support closer to home. Our service offers a combination of behavioural support and nicotine replacement therapy. At your first appointment, we will discuss your smoking habits, set a quit date, and together we can work out a plan for how to stop smoking. I will be there to support you all the way. If you are struggling with withdrawal symptoms and cravings, we can consider the use of nicotine replacement therapy, such as nicotine patches, lozenges, or inhalers. These products will help to ease withdrawal by giving you small amounts of nicotine, but without the harmful toxins and chemicals that you would get from smoking tobacco. They are free of charge, safe to use in pregnancy, and can increase the chances of quitting successfully. So, take the first step today towards a healthier you by speaking to your midwife about the stop smoking support available, or you can email me at healthandwellbeing.ulhg@hse.ie.
Quitting smoking is a great achievement with huge benefits for you and your baby. Let's take a look at my quit journey. My name is Teresa and my quit journey started when I went to the maternity hospital in Limerick. I spoke with a midwife about my smoking habit and she asked me would I quit. Would you like me to refer you to the quit team? She said. Yes, please. I never wanted to be a smoker anyway. I received a call and got an appointment for a face-to-face meeting with a member of the QUIT team. I showed up and I've been smoke-free since then. I would advise anyone trying to quit to get some help and talk to a member of the QUIT team. They are so good with advice and don't judge you. I'm glad now that I've given birth to my baby boy, and I'm so glad I didn't smoke during my pregnancy. I was really worried that smoking could affect my unborn baby. Being pregnant is a great reason to quit smoking. Having a smoke-free pregnancy and home is best for everyone in your family. Talk to your midwife today. Take back control and get free support to quit smoking. Call 065 686 5841 or email quit.midwest@hse.ie.
Hello, my name's Jane Conway and I'm a senior physiotherapist here in University Maternity Hospital Limerick. During the antenatal period, we regularly see patients complaining of pelvic girdle pain affecting their ribs, thoracic spine, or in relation to their hands suffering with carpal tunnel syndrome. In the postnatal period, we regularly see patients suffering with pelvic floor dysfunction that may affect and cause symptoms of their bladder and bowels or pelvic organ prolapse. Antenatally, pelvic girdle pain is the most commonly treated condition here in our physiotherapy department. Common aggravating factors include going from sit to stand, turning in bed, stairs, or prolonged sitting and prolonged standing. All those movements can cause pain in your lower back, into the gluteal region, around to your hip, groin, or into the pubic joints. If you feel you're suffering from pelvic girdle pain or any other of those ailments regularly that occur during that antenatal period, please speak with your GP or consultant and request a referral to physiotherapy. We also participate in online educational classes. During these antenatal educational classes, we give women advice and education on how best to prepare for labour in one class, and in another class we give advice on exercise, how to do your pelvic floor exercises, and different coping strategies that you can do during your pregnancy to make that period a more enjoyable pregnancy. During the postnatal period, we aim to see all mums on the postnatal ward. During this time, we teach mums how to correctly do their pelvic floor exercises. We'll teach you gentle spinal mobility exercises and also light strengthening exercises for your abdominal muscles. In the postnatal period, in the early days, you can self-refer to the physio department if you're having symptoms affecting your bladder and your bowels, pelvic organ prolapse, or persistent pelvic girdle pain. Congratulations on your good news and best of luck on your new adventure. Thank you.
Congratulations on your pregnancy. Hello, and my name is Audrey and I'm a midwife here in the Antenatal Clinic in the Maternity Hospital in Limerick. You will be invited for a booking visit when you are 12 to 14 weeks pregnant, and this visit involves meeting a midwife one-to-one who will check your personal information like your name, your address, your telephone number and your next of kin. We will ask your medical, your surgical and any history which includes your illnesses, medication you are on. All of this is necessary to plan the best care for you and your baby. If you require an interpreter, one will be arranged for you on the day. You can have one adult accompany you on the day of your booking also. The midwife, as part of our assessment, will look at your lifestyle and identify areas which can be improved upon, such as your smoking, diet and exercise. Relevant referral will be made. Information leaflets and books will be provided and discussed with you, and the midwife will discuss any concerns or worries you may have. And we have services such as the perinatal mental health, medical social worker, dietitian, physiotherapist and other support organisations if you require them. During this visit, the midwife will take your blood pressure, test your urine, measure your weight and height. All of these are just baseline measurements. A dating scan is performed on all our booking visits. Now, some scans are done prior to your booking visit. More can be done on the day of the visit. As a part of the booking visit, we do recommend a series of bloods to ensure optimal health for you and your baby. You will be provided with a combined antenatal care card, known as the white card, which we ask you to bring to each of your visits and also to your GP. This booking visit can take up to 2.5 hours, so we do recommend you to bring a drink and a snack. On your return visits, you will be asked to attend our clinic at 28 weeks, 34, 38, 40 and 41 weeks. Dependent on your pregnancy journey, you may be asked to attend much more frequently. And each visit, your midwife will test your urine, monitor your blood pressure, ask about your fetal movements and discuss how your pregnancy is progressing and provide relevant information and discussion relevant to your stage of pregnancy. We offer 3 ultrasound scans during the pregnancy, including the booking scan, your anomaly scan at 20 to 22 weeks and a growth scan at your 34-week visit. Blood tests will be offered at 28 and 34 weeks to determine your iron levels, blood group and antibodies. Dependent on your care pathway, a member of the obstetric team will also review your progress. We look forward to sharing your pregnancy journey from the entire team at the University Maternity Hospital.
Hello, my name is Colette. I'm the Clinical Midwife Manager in the Diabetes Department in the University Maternity Hospital Limerick. My role is caring for women with pre-existing diabetes and gestational diabetes from early pregnancy to late diagnosis and postnatal. The service consists of 2 CMMs, a dietitian, a consultant obstetrician and a consultant endocrinologist. Here in UMHL we perform oral glucose tolerance tests of women who have 1 or more of the 12 risk factors for gestational diabetes. This test can be carried out at any stage of pregnancy, but more commonly carried out between 24 and 28 weeks gestation. This is a diagnostic test to confirm gestational diabetes by way of a blood test. The patient arrives fasting and a blood test is done to determine the fasting glucose. The patient drinks a solution called Rapulose, and after an hour a second blood test is done. After 2 hours, the last blood is drawn. These are sent to the laboratory and are usually back to us by the end of the day with the results. The glucose tolerance test can be organised from the patient's booking appointment and can be performed in one of 3 hospital sites, Limerick, Ennis or Neenah. If the patient is confirmed to have gestational diabetes, an education class is organised with the patient and a diabetes information pack along with a meter for checking their own blood sugar levels at home is given to the patient. The patients are also referred to the dietitian to help with their diet to control their diabetes. The patient will then be seen in the diabetes clinic frequently, where they will have a full antenatal appointment along with their blood sugars reviewed. If a patient requires further treatment to manage their diabetes, this service is also provided by our team. If a pre-existing diabetic, type 1 or type 2, becomes pregnant, they are also taken care of in our service. Once the hospital receives the referral, the patient is seen between 8 to 10 weeks gestation to be assessed by us, the diabetes team. These assessments involve a one-to-one with the CMM2. A follow-up appointment is made with our endocrinologist, who will provide diabetes care along with the consultant obstetrician to the patient throughout their pregnancy. The diabetes service is available Monday through Friday and are contactable via phone for any queries or concerns.
Hello, my name is Paula. I'm a senior radiographer and I work as part of a team of sonographers at the University Maternity Hospital Limerick. Our department is on the lower ground floor next to the antenatal clinic. We provide scans for all stages of pregnancy, including early pregnancy, dating, anomaly and growth scans. During your pregnancy, you will be offered a minimum of 3 scans. The first scan is to date your pregnancy and is performed at approximately 13 weeks. We require a full bladder for this scan. The second scan is a detailed anatomy scan, done at approximately 22 weeks. The third scan checks the growth of your baby and is undertaken between 32 and 34 weeks. After your dating scan, you will receive an appointment in the post for your anomaly scan. You will also be provided with some written information to read about the scan before attending your appointment. We will also include a consent form for you to sign. We ask that you bring the signed consent form with you on the day of your appointment. The anomaly scan is a detailed scan taking approximately 30 minutes depending on the baby's position and whether your baby is cooperating with us at the time of the scan. The scan is non-invasive and done through your tummy. We will be taking your baby's measurements, determining the location of the placenta and assessing the amniotic fluid. We will also examine the anatomical structures of your baby, including the head, face, chest, heart, bladder, kidneys and limbs. At this stage in pregnancy, it may not be easy for you to make out what you are seeing on the screen, but we will explain what we are looking at and we welcome any questions you or your partner may have. We take images during the scan, so you will be provided with pictures at the end. We look forward to welcoming you.
Welcome to the Labour Ward here in University Maternity Hospital Limerick. My name is Cassandra and I've been working here on the Labour Ward for the past 4 years. We have an excellent team of midwives who are happy to support you throughout your labour journey and facilitate you with any specific birth preferences you may have. We promote being active in labour by mobilising and staying upright as much as possible. This may be done by standing upright at the bedside or using the birthing ball or cup. Labour is a different experience for each woman and her birth partner. A midwife will be with you during your labour. She will be there to monitor you and your baby throughout. Monitoring of your baby will involve the use of a Pinard fetal stethoscope or handheld Doppler and possibly a cardiotocograph machine. Your midwife will palpate your contractions as part of her assessment. She will monitor the length, strength and frequency of your contractions. The midwife will record your vital observations such as temperature, pulse and blood pressure and observe your general well-being. The obstetrician may also be involved in your care during labour. It is really important that you prepare your body and mind for labour. This could include exercise, birth preparation classes or labour hopscotch. This will help you to cope with your contractions and manage your labour better. Water immersion for labour is available in our Danu suite as an option if you meet the criteria. If this is something you want to know more about, then you can talk to your midwife or doctor at your antenatal appointment. We look forward to meeting you.
Hi, my name is Helen and I am a midwife and lactation consultant on the infant feeding team here at University Maternity Hospital Limerick. Our team consists of lactation consultants and midwives who are here to help you get breastfeeding off to the best start. Our team provides support to you throughout your pregnancy and up to 6 weeks postnatally. Breastfeeding has many health benefits for you and your baby, and while breastfeeding is the most natural way to feed your baby, it is a skill that you will learn together. It can take time and practice to get breastfeeding established, and it may be challenging along the way, but with the right information and support, you can start breastfeeding and continue for as long as you want to. Breast milk contains everything your baby needs for normal growth, development and good health, and is constantly changing. Breast milk helps to protect your baby from illnesses such as chest, ear and tummy infections. It can help to lower your baby's risk of allergies and reduces the risk of obesity and diabetes when they are older. If your baby is born prematurely, then breast milk is the first medicine to give your baby. Breastfeeding is good for you as it helps to reduce the risk of bleeding after the birth and will help with the uterus to return to its normal size more quickly. It reduces the risk of ovarian cancer, breast cancer and diabetes. Breastfeeding is convenient. It will save you time and money and is better for the environment. You can prepare yourself for breastfeeding by attending our antenatal breastfeeding classes, which are currently online and are run twice a month. If you would like to book a class, please send an email to parent.education@umhl.hse.ie with your name, phone number, patient ID and expected due date. The booklet, Breastfeeding a Good Start in Life, will be a great resource to you and is available online and from your healthcare provider. More information is available on mychild.ie. At birth, your baby is placed skin to skin for at least 1 hour. Skin to skin will keep your baby warm, regulate their heart rate and their breathing, and will create a feeling of calmness and closeness. Skin to skin will encourage your baby to feed, and early frequent feeding will help with getting breastfeeding established. Colostrum, or liquid gold, is the first milk. It is called liquid gold because of its colour and importance. Your body makes small amounts of colostrum, but it is full of antibodies that protect your baby from infection. Every drop counts. Colostrum harvesting is the collection of breast milk by hand from the breast in pregnancy. It is done after 37 weeks and is frozen for use after the baby is born. It is helpful to have extra milk as there may be situations when a baby may need additional milk feeds. If you were interested in colostrum harvesting, please call our department at 061 48 3102 at around 34 weeks. Leave your name, phone number and a brief message and we will call you back. We also run a breastfeeding clinic by appointment on a Monday afternoon where we will see you with your baby up to 6 weeks postnatally. To arrange an appointment or to call for breastfeeding support, please telephone 061 48 3102. Leave a brief message, your phone number and we will call you back. Thank you for listening and remember, every breastfeed makes a difference.
Hello and congratulations on your pregnancy. My name is Ivana Lam and I'm the Designated Midwifery Officer here in the University Maternity Hospital Limerick. We've introduced the use of the Labour Hopscotch framework. I will explain how you can use the framework for optimal fetal positioning during your pregnancy and how to use hopscotch for labour and birth. Labour Hopscotch is an active birth framework that can be used from 28 weeks onwards to help prepare your body for labour, encourage your baby to get into the ideal position for birth, otherwise known as optimal fetal positioning, and can help your labour progress. Research has shown that women who used Labour Hopscotch in their pregnancy had higher rates of spontaneous labour, meaning they were less likely to be induced, shorter labours, less likely to need an epidural, less likely to have an assisted birth or a caesarean birth, higher satisfaction rates, and increased partner involvement. The bottom square of the framework contains positions like squats, lunges, pelvic tilts, and going sideways up and down the stairs. which will encourage your baby to rotate into the optimal position, which is facing your back. This position is associated with shorter labours, reduced need for strong pain relief like epidurals, and a reduced need for an assisted birth like a caesarean section. We would recommend you practice the bottom square of labour hopscotch daily from 28 weeks onwards. Keep fit, exercise, and maintain a healthy weight. Labour hopscotch can be used at home in early labour if you are admitted to hospital, and also when you are on the labour ward. Hopscotch stations are available around the hospital, and birthing aids like balls, peanuts and cubs are available for you to use. You can use labour hopscotch when you feel contractions are starting. The key is to change position every 20 minutes. Think upright, forward, open, as these positions will use gravity and encourage your baby to descend lower into your pelvis. When a contraction is beginning, adopt a position like a squat or lunge and remain in this position for the duration of the contraction, and then rest. Using these upright positions will ensure your baby's head comes into good contact with your cervix, which will help your cervix to dilate. Labour hopscotch can also be used with other pain relief methods like gas and air, TENS machines or pethidine. In using labour hopscotch, your birth partner can support you by suggesting position changes. Good luck with your preparation. We wish you a positive experience.
Gestational diabetes is one of the most common health problems that can happen during pregnancy. It affects as many as 12% of pregnancies in Ireland and can lead to serious problems for both mum and baby. Certain women are at higher risk of developing gestational diabetes. For example, if you are overweight, if you have a family member with diabetes, if you had gestational diabetes in a previous pregnancy, or depending on your ethnic background. If you are at risk, you will receive a blood test for gestational diabetes between 24 and 28 weeks of pregnancy. If you are diagnosed, there are day-to-day changes you can make to stay healthy. How much exercise you get and what kind of food you eat can have important effects on your health and your baby's health. But what happens when you have gestational diabetes, and how can diet and exercise help? Food and drinks are broken down in your digestive system. The sugar they contain is absorbed into your bloodstream. But sugar needs insulin to work. Insulin is made by the pancreas and helps sugar get into your cells. Insulin acts like a key that lets the sugar move from the bloodstream into the cells of your body, where it is used for energy. Pregnancy hormones change the way insulin works in your body. In the later stages of pregnancy, these changes make it difficult for insulin to unlock the cells and allow the sugar to enter. This is what is known as insulin resistance. Some insulin resistance is normal in pregnancy, but this means that your pancreas needs to work extra hard to keep blood sugar levels in a healthy range. When you have gestational diabetes, your pancreas is not able to keep up. As a result, too much sugar is left in the blood. However, a carefully planned diet with high-fibre carbohydrates and no added sugar can make it easier for your body to manage the sugar in your blood. Exercise will also help keep blood sugar low, as it improves insulin's ability to unlock the cells and uses up sugar for energy. If blood sugar is controlled, your chances of a healthy pregnancy are the same as a non-diabetic mum. This makes diet and exercise powerful tools for a healthy pregnancy. However, if blood sugar is not well controlled, this can lead to problems in both mum and baby. In a study of 23,000 pregnant women around the world, researchers found a link between high blood sugar in mum and babies that had grown too big. Researchers also found a link between high blood sugar and preeclampsia, premature delivery, need for caesarean section, birth injury, and abnormal sugar control in baby. Diabetes during pregnancy can also put you and your baby at risk for problems later in life, including type 2 diabetes and heart disease. But there are actions you can take. Changes in diet and exercise, combined with close monitoring, can successfully manage blood sugar in 7 out of 10 pregnancies. So no better time to start than now. To learn more about Irish research on maternal and newborn health, you can visit the HRB Mother and Baby Clinical Trial Network's website.